Hi, I'm Dr. Greg Castello, board certified family practice with CastelloWellness.com, and today we're going to talk about the MERS virus, Middle Eastern Respiratory Syndrome, which has been in the news in the U.S. recently because the first U.S. case showed up around May 1st when a healthcare worker from Saudi Arabia who was sick flew through O'Hare Airport to visit his family in Indiana and had the infection and was actually hospitalized for about 10 days with the infection. He's going to be discharged and did fine, did not die from the infection, but we're now the 7th country with documented MERS infection. This was first identified in 2012 in Saudi Arabia when a 60-year-old gentleman died from the infection. It was thought that he had a novel influenza virus, but they were able to isolate this coronavirus, which is actually in the cold virus family, from his lungs. They determined it was a coronavirus or cold virus that had never been seen before and initially was described as novel coronavirus and then later developed the term of MERS, Middle Eastern Respiratory Syndrome. We discovered a virus very similar to this in Egypt in what are called Egyptian tomb bats. It was not exactly the same virus, but then later, after the majority of these cases were identified in Saudi Arabia, it was determined that infected camels actually had the exact same virus as the human virus, and a camel to human or zoonotic transmission was first proposed. There has been human to human exposure, so even if you are around someone who's sick, you have the possibility to contract the infection. This was the concern that the gentleman was on an airplane. He went through a busy airport and was seen by over 60 people in the hospital, of which they had to quarantine these people. There's been no reported cases in the U.S. Related to this patient who was infected in Indiana. Right now, about 1 out of 3 people who are known to have this infection actually die from the disease from lung failure and kidney failure. That's not saying that 1 in 3 people with the infection die, but of the people that are identified, this would be the sickest of the sick, 1 in 3 die. So it's possible people get this infection as a milder version, do not go to the hospital and never get diagnosed. But so far the death rate percentage-wise is far greater or higher than the death rate for SARS, which was in Asia about 10 years ago. That's a similar coronavirus. There is no treatment for the virus itself. Supportive care, hospitalization, treatment of pneumonias, protecting the kidneys, hydration are all standard treatments that help improve your survivability. The sicker you are, we know the greater chance of dying. The poorer you are, or the poorer your health care is. So in a third world country, you're greater to die than in a first world country with adequate health care. There is no concern at this point that this will become a global pandemic, as human-to-human transmission appears to be very limited. That may change in the future if the virus mutates. Obviously, the common cold coronavirus is very contagious, but it is not at all lethal. So if the virus were to come in contact with someone with a cold virus, this is always the concern that you get a mutation where the two viruses blend and you develop a virus that is both highly lethal as well as easily contagious from human to human. And at that point, we'd be in trouble. But right now, there's no evidence of other than minimal human to human exposure. Dr. Greg Castello, thanks.